Cos'è cambiato nella vita dei pazienti con fibrillazione atriale dopo la disponibilità dei nuovi anticoagulanti orali? Cos'è cambiato in meglio, si spera, e cosa resta ancora da fare? Noi ne parliamo con Trudie Lobban, fondatrice e chairman della Arrhythmia Alliance, un'organizzazione di pazienti molto importante che abbiamo incontrato qui a Londra al congresso dell'ESC durante la presentazione di un documento molto importante incentrato proprio su questi temi, cioè su cosa resta ancora da fare per questa condizione clinica, un documento che ha come titolo The Future of Anticoagulation for the management of atrial fibrillation, which is the sentiment of someone who has atrial fibrillation. What does it mean, have this disease?
Atrial fibrillation for many patients is very difficult to even say, let alone understand, and all too often AF is referred to as alone and frustrated, and that sums up how patients feel. They feel very alone, they feel very frustrated. It may have taken them a year, 2 years before they're diagnosed, and still nothing happens. Anticoagulation will reduce your risk of stroke, but it will not take away the symptoms that you experience with AF. So it's important, once you know you have AF, to get anticoagulated to reduce your risk of an AF-related stroke, but to then go on to be treated for the AF and not to stop the anticoagulant just because the symptoms may go away or you don't feel better. It is important. Diagnosis, protection and correction of the heart rhythm.
Are you satisfied, the patient are satisfied about the situation of today in which there are 4 drugs able to treat atrial fibrillation, so to prevent the stroke?
It's excellent that there are now 4 new anticoagulants on the market, as well as the existing ones, and also a device, left atrial appendage. However, the important thing is that patients have access to these. These therapies will help reduce the risk of an AF-related stroke, which is the most devastating type of stroke you can have. So we do need to make sure more awareness, more education, and more patients have access to the new therapies.
So the situation is better than 5-10 years ago, but what lacks exactly? What patients are asking to healthcare organization, to physician, to the general population?
It's much better than 5-10 years ago. However, it's gaining access. First of all, it's diagnosing atrial fibrillation. We can have all the medications, but if somebody isn't diagnosed and seeing an appropriate doctor, then they're not going to be offered this therapy to reduce AF-related stroke. So it's important that diagnosis through simple pulse checks, know your pulse and ECGs, and then seeing the right doctor who will go on to diagnose, anticoagulate you and refer you on for treatment for AF itself.
Trudie, here together with Professor Cam you have presented a very important document entitled The Future of Anticoagulation. Which are the 3 most important actions you ask to everybody?
The Future of Anticoagulation report that we've launched, Professor Cam and myself, most importantly, the action we need is to engage with healthcare policymakers, to raise awareness, to improve education, and by doing that, more patients will have access to the appropriate therapies. AF will be diagnosed. You will be protected from AF-related stroke with the new anticoagulants, and also your heart rhythm will be corrected by going on to have appropriate treatment.